Why did the plane land on the football field? To score a touchdown. How do you know if you are a pirate? You just are.
You're listening to Weird Medicine with Dr. Steve on the Riotcast Network, riotcast.com.
I need some suction in the carotid. I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Jenny McKinney.
Hey, everybody.
Comedian extraordinaire. Do you like comedian or comedian?
Oh, I'm not picky.
Comic?
Toots, whatever.
This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347. Take it away, Jenny. It's Pooh
Head.
There you go. Wow, very good. She actually listens. If you're listening to us live, the number is 754-227-3647. That's 754. Final exam, Jenny.
Final exam. Pooh Head.
No.
No, I don't know.
754-22 penis.
Oh, 22 penis.
Yes.
All right.
Or 754 bare nip, which is my favorite.
Oh. All right. I'll remember those.
Follow us on Twitter at Weird Medicine, at Lady Diagnosis, at Dr. Scott WM. Are you on Twitter? No? Okay, we'll have to
Not yet.
fix that.
Okay.
Visit our website at drsteve.com for podcast, medical news, and stuff you can buy, or go to our merchandise store at cafepress.com/weirdmedicine. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. All right, very good. Hey, so we've got Jenny in studio with us today, Lady Diagnosis, and Dr. Scott may be on the way. They texted me at 12:58 to ask if we were going to still record at 1 p.m. So, I don't know if they're going to show or not. So it's like, call me. Don't text me. Call me.
Yeah.
I'm just weird that way. I get so many text messages and so many alerts that I just ignore them. And then about 10 times a day, I'll look at my phone and I'll catch up on everything.
Right. And sometimes it's too late.
But if you want me right now, call me.
Yes.
And and if you want me right now, call me, 754-227-3647. In the meantime, don't forget stuff.drsteve.com. That's stuff.drsteve.com for all your shopping needs. We're going to be talking about genital hyperhidrosis today, and I'm going to put up a new product on there for people who have sweaty junk at stuff.drsteve.com. You can see all the different products that we talk about on the show, and then or you can just click straight through and go to Amazon. It does help to keep us on the air. Also, tweakedaudio.com, offer code FLUID. Jenny, if you want any earbuds, tweakedaudio.com is a good place to go, because if you use the offer code FLUID, you'll get 33% off.
Awesome.
That's a lot of these places will give you 5 or 10%.
Right.
33% off is awesome.
Yeah.
Don't forget, even though Dr. Scott isn't here, we will support his website. It's simplyherbals.net, because he makes the best nasal rinse on the market, in my opinion, and seems to have decent quality control, so there won't be amoebas in it. But check him out at simplyherbals.net. And I can attest to Dr. Steve's rule. Jenny, do you know what Dr. Steve's rule is? Have you been listening long enough to know? Well, Dr. Steve's rule is a mathematical relationship that says for every 35 pounds of weight that you lose, you gain 1 inch of penis length.
Oh, good.
And I can, maybe TMI, attest that this is true because I've lost about 35, 40 pounds. And I actually got the tape measure out. And yes, indeed, well, I'll do anything for science.
It's for the children.
A good inch. So, and I did that using Noom. Noom is a psychology app. It's not a diet. And it really changed my life. It changed my relationship with food. If you want to do it with me, go to Noom, Noom.drsteve.com. And one of the things that I used to control my intake was to quit just cooking mass amounts of food, and I'm also lazy, so I started using Freshly, and Freshly is fresh prepared meals. They make eating right super easy. They're gluten free, which is good for me. You don't have to be gluten-free if you don't want to be, but these are. You can use my link to get 6 dinners for $39 for 2 weeks. That's $20 off each week. Give it a try and let me know what you think. Look, it's you're popping it in the microwave.
Right.
Am I doing that?
I think it's the...
it's the fan?
Yeah.
Okay. All right. So, I'll tell you what, turn the circulator off. And then just position it so it's blowing in here, but not making that horrible noise.
Okay, there we go.
You think?
You want to go in this?
No,
way?
no, I don't care. But
okay.
I just
it'll still circulate.
I'm still hearing it though.
Oh,
you hear that? Okay,
is that a little bit better?
Yeah. Are you getting any of that?
No, I think I'm good.
Okay. So, thank you. Sorry,
Yeah.
technical. I'll edit that out. I always say that, and then I don't. I had a 2-minute coughing fit on the show while I was doing an interview with these two guys from DC On Screen podcast, which, by the way, check them out. They're good little fellers, and if you're interested in superhero stuff, that's a great podcast. But I was going to edit it out, and I did edit it out. I remember doing it, but then apparently I must have hit Control-Z one too many times when I was undoing some edit that I did. And apparently not only did the 2-minute coughing fit go on the podcast, but on the Sirius XM show as well.
So you put it back in.
So I keep saying I'm going to edit these things out, and I never do. Anyway, but you can go to freshly.drsteve.com. It's freshly.drsteve.com, and you can try it out. If you don't like it, you can cancel anytime. If you're into sports betting, check out bet.drsteve.com, bet.drsteve.com. Just takes you to BetDSI. It's the place I found that's the easiest to sign up for, and they've got some cool promotions, and my kid is a genius when it comes to NBA. So next season, I'm going to see if he can make us some college money.
Awesome.
So
that'd be great.
Or some walking around money. So, and then if you want archives of this show, and why would you? But if you do, go to premium.drsteve.com. Use the offer code FLUID. You can get 3 months for $1 a month, and then after that, it's $1.99 a month. If you just download them all, and then you'll have them, and then you can cancel.
Nice.
So it's just there. It's not there for us to make money. It's there to keep my co-workers out of there, because I figure they're not going to spend $1.99 just to see what I'm up to.
Yeah.
All right. All righty. I understand you have a news story that you wanted to do today.
Yeah. I have a few.
Okay.
But I did. Did you see online where the 84-year-old donated his kidney to his neighbor?
No.
Yeah, she needed a kidney and had put some signs out in her yard. She probably thought he was coming over to maybe borrow some sugar or something. And he said he wanted to donate his kidney, but he's 84 years old.
Sure.
Doesn't that seem kind of old?
No.
For surgery?
Kidney. Well, It depends. There are young 84-year-olds and there are 84-year-olds. We have two. We only need one.
Right.
And if he's got good kidney function and didn't have a lot of cardiovascular disease where he's got a clogged up kidney, there's really no reason that I can think of why he shouldn't be able to donate. Now, the older you are, the more risk there is. But really, there's this thing called the Goldman criteria. Let me see if I can find it on here.
Okay.
And we'll look, because what you're really worried about is what's the chances he's going to have a massive heart attack during or after the surgery, right? That's really what we're worried about in
Yeah.
a situation like this. So let's get this Goldman calculator out. Okay, wait a minute. I've got my mouse is turned around. So this is called the Goldman criteria for cardiac risk.
Okay.
And if you have high risk, then you could have 78% chance of complication, but low risk is like 1%.
Oh, wow.
So the first criteria, age greater than 70 years. He gets 5 points for that. This is what they call a multivariate analysis, meaning you take all these criteria and you assign them points, and then at the end, you just add all the points up together, and it can stratify these things based on risk. Okay? Now, let's just say he doesn't have anything else. He's got a normal kidney function. It's not an emergency. It is intraperitoneal. So they're going to have to, actually, it's not technically, but I'm going to count it as that. The kidneys are actually behind the peritoneal cavity, or the peritoneal membrane. But since this is sort of major surgery, even though they can go from the back and I'm going to say this is intraperitoneal just to be conservative.
Sure.
So he has 8 points. At 85 years old, donating a kidney. This is class 2. He's got a 7% chance of having a major cardiac complication after this surgery. Now, that means he has a 93% chance of just sailing right through. Those aren't bad odds. If I gave you those odds and sent you to Las Vegas, you would, bet everything on black.
Yeah.
Right? You
Yeah.
know? If you only had a 7% chance of losing everything, you can just push that out of the way, and then Lady Diagnosis is here. She was doing the limbo with the fan, just trying to stick her chest out so we could check it out. That's all. Yeah.
754
Lady
bare nip.
Diagnosis. That's
Exactly.
Lady Diagnosis. You remember Jenny?
Yes, hey, Jenny.
Hey, girl.
So they first met when Lady Diagnosis was the hostess for the Funniest Person in the Tri-Cities competition, and Jenny was one of the finalists in that competition.
How long ago was that?
Yeah.
That was
2 years.
Yeah, it's up there somewhere. Maybe I don't have a poster on that. We have
Or no,
the
it's
new
up there.
comedian showcase.
Yeah.
Was it 2017?
I
That
don't
was
know.
2017. So
Yeah.
Yeah, 2017.
Yeah, good times.
Yeah, it was awesome.
That was fun.
What's the date on that new comedian showcase?
May 11th.
May. But we did. So did we do that quickly after?
Because it was
It was in April that we did the Funniest Person
Was
in
it
the
April?
Tri-City. So I'm thinking it was a year before that. I had a funny feeling it took us a year to get around to doing those new comedian showcases.
Yeah.
Yeah, I
It took
think
a
you're
while.
right.
Yeah.
Yeah. Actually, I think you're right.
Yeah, and
Yeah.
we should have done it right away. But anyway, that's a long
Yeah.
story. But anyway, check us out at etncomedy.com. We've got Rich Voss coming in August. And save the date for that. And come to Kingsport, Tennessee. And come see that show. You're not going to want to miss that. And it's August 1st. Admission is free. And there will be craft beer there.
Nice.
There will be music. There will be local comedians. Perhaps Jenny, perhaps not, depending on after we see her new set. And here's Dr. Shithead. Hello, Dr. Shithead.
Good afternoon.
That's hilarious that you answered to that. Okay, you got your mic on? This is very professional.
Better than some of the other shit you call me.
Yeah, that's right. All right. Hey, how's it going?
Awesome.
Good.
Good to see you.
Good
We
to
were
see
just
you too,
talking
man.
about
Welcome back.
We were just talking about an 85-year-old dude that was going to donate a kidney, and Jenny said, "Isn't he at high risk for having a problem at 85 donating a kidney?" And we did this thing called the Goldman criteria for cardiac risk in non-cardiac surgery, and he only had a 7% chance of having a major complication. That's higher than you or I would. It'd be a 1% for us, but still 93% of the time he'll sail right through it. And
Yeah,
that's
the
a
lady he's donating to is 72.
Yeah.
Oh.
Yeah, he's trying to get
So
in
he
her
knows
drawers.
her.
Yeah, it's his next door. Like, they live in the same community. So, yeah, what if she just thought he's coming to give sugar or needs some sugar, and
Give
he's
some
like,
sugar.
I'm going to give...
She's like, I'm taking a kidney.
He's trying to. Okay, anyway. All right. Yeah, so cool. So good for him. All right,
Yeah,
what
and
else
he'll
you got?
lose weight at the same time.
Yes, he will. He'll lose about
question.
a half a pound.
About, this is kind of random, but my sister, when we were growing up, she would wet the bed,
Okay.
which is
Yep.
terrible because we shared a bed, so it's
Yeah.
real bad.
Oh, jeez.
Oh.
Yeah, that's bad.
But my mom took her to a doctor, and the doctor had recommended that we listen to Subliminal Bedwetting.
Okay.
Like it was cassette tape at that time.
Yeah.
So, yeah.
How did that turn out?
I don't know. I just wanted to know what your thoughts were on like the bedwetting, and then do you think it really was helping? I don't know. I think she was just sleeping so hard.
Yeah.
that-
How old was she at that time?
Oh, it was from 7 to. Well, probably younger because we wanted more room in our. Oops, I'm sorry, more room in our bedroom. So we put our just slept in the same bed. It was probably maybe like 5 to 12.
Yeah.
Yeah.
It's, okay, so bedwetting is called eneuresis, and it's 20% of 5-year-olds have it, and 10% of 10-year-olds. So, 1 in 10 will have it. And usually, older than 10, it'll remit spontaneously at the rate of about 15% per year.
Oh, okay.
So, so when do you think the last time she wet the bed? How old was she?
Probably 11 or 12.
Yeah, there you
I
go.
think.
So that's about right.
Yeah.
Now, so she was going to stop anyway. These subliminal tapes, I don't think that does anything. My mom tried to get me to learn multiplication tables using subliminal. Yeah, and I'm so old that what we had was this vinyl record, and it would play, 3 times 3 is 9, 3 times 4 is 12. 4 times 6 is whatever it is, because I never did learn it. I know 4 times 3 is 12, and then you multiply that times 2 to get 4 times 6. So I learned all my multiplication tables that way, which
Whatever works.
is either really smart or really dumb as hell. I had to have tricks to learn my multiplication.
That's how I learned the
tables.
states in a song in alphabetical order.
There you
Oh,
go.
yeah.
But
Yeah.
this thing did nothing.
So-
This thing did nothing. I fall asleep watching TV, and it's not going into my head. I think it is. It seems like it is, but there's no any recollection of it whatsoever. So I'm not a fan of sleep learning. I just don't think it works. For some kids who have bedwetting, I've seen these shock pads when moisture hits them, they shock them. Your father did that to you, Dr. Scott?
Oh, yeah.
Well, okay, don't make silent hand gestures to lady diagnosis. Pipe up. That's something interesting. We're on a radio show.
Right.
Tell us about it.
No, we didn't do that. There was other methods to correct aberrant behavior, like beatings. Because
Yeah.
there are 3 of us.
Yeah.
Three boys
So you would
and
piss
one
the
mom.
bed and your mom would beat you?
Oh, no. Brothers.
Your brothers would beat
Yeah.
you.
So we
Oh,
stopped
geez.
pretty quickly. Yeah, they're bigger than I am.
Yeah, I guess that would be an incentive to not wet the bed. I don't know that you have any control over it. Now,
No.
they will use a spray called DDAVP, and what that is it's an intranasal vasopressin. And what vasopressin does basically just stop you from urinating. So if you've got a kid that, and temporarily,
Yeah.
if you've got a kid who bedwets and they're not going on sleepovers because of this problem, they're 10, 11, 12, and it's embarrassing. Adolescent girls particularly, and boys too, they can get a prescription of this DDAVP and use it for sleepovers, and it's about 100% effective.
Yeah.
And they just know that generally they'll grow out of it. So there you go.
Cool.
Yeah.
Yeah.
I'm not a fan of the shock things at all. I just
No.
Terrible.
It's a terrible idea.
and what it's supposed to do is wake them up, and so that it trains the brain, instead of going into deep sleep and pissing, that if you're pissing, you should go into a lighter sleep so
Yeah.
you wake up.
I just would be scared of pissing then after that.
Yeah.
Because I'd
Yeah.
be getting a shock.
Yeah. It's Pavlovian. You're just going to feel,
Yeah.
you're going to have this weird
That
feeling
sucks
anytime
because
you
when I
piss.
laugh too hard now, even now, if I go on go-karts, it's 100% guaranteed I'm going to urinate.
Really?
Yeah,
trampolines.
I just laugh. Or if somebody trips, I'm going to lose it. I can't stop laughing, and then I just pee.
Really?
Yeah.
So other people's misfortune causes you to urinate. That's
Yeah.
actually called instant karma.
Okay, that's pretty good.
Your glee over someone's
There's a German
misfortune.
word for that.
Schadenfreude.
Schadenfreude,
Yeah.
I love that word.
That's a good word. All right. Okay, doke. You got anything else there? Well, let's save some for the next show.
Yeah, that's fine.
Yeah, good.
Yeah.
Okay, awesome. I had one that I was going to bring. on autism and the gut microbiome. Gut bacteria, and this is from Medical News Today. Gut bacteria may contribute directly to the development of autism-like behaviors, according to the results of a new study in mice. Okay, so this is not a great study for humans, but it is interesting. We may be narrowing in on this whole mind-gut thing because that's for real. Seems to be too much evidence that there's a mind-gut axis that has to be healthy. Or, if the gut biome isn't healthy, then the mind is affected by it. And it's weird. It's like, why would that be? And how would it be? So we've got a lot to learn about this. When we are born, our guts are pretty sterile, and within just a few days, we're colonized with these some mostly beneficial bacteria. A couple of crummy ones will get in there, but the good ones usually will crowd them out. And, but it is amazing that we have this sort of relationship with these bacteria, and they benefit from it, and so do we. But there may be more than just them being there to fertilize or, to ferment sugars and stuff like that and cause flatus. There may be more to it than that. So it's pretty interesting. It said in recent years, numerous studies have revealed differences in the bacterial composition of the gut microbiome between individuals with autism and neurotypical people. I like that word, too. Instead of saying normal people, neurotypical people. 1 in 59 children in the United States have received a diagnosis of autism spectrum disorder, which is about 4 times more common in boys than girls, and it occurs across all socioeconomic, ethnic, and racial groups. The question is this a marker of disease or is it a cause of disease? And that, we talk about this with vitamin D all the time. Yes, low vitamin D is associated with cancer and heart disease, but is it just a marker? In which case it's just telling you that you're at risk for those diseases, or is it a cause? In which case, supplementing vitamin D would hopefully prevent it.
Yeah.
And so the only way to really know is to find these kids and correct their microbiome and see if it makes any difference on their behaviors, and then also somehow try to figure out a way to treat this before the autism kicks in and see if you can prevent it. So if you give a bunch of infants probiotics, which don't do, by the way, pediatricians recommend against that for right now, at least some of the ones that I've talked to, because you got an immature immune system and you're throwing bacteria at these kids. But you could do a controlled trial at a university center and see if when you give kids certain bacterial colonies in their food to colonize their gut, is there a decrease in the diagnosis of autism in those kids? That'd be an easy study to do. First, you got to pick. Now, how do you pick which bacteria? Well, you got to see the ones that they're different in.
Right.
And so then you pick to supplement those between the neurotypical people and the autism kids. Supplement those. See if you can, number one, establish colonies of those. Maybe they have some weird receptor or something that doesn't let those colonies be established. And that may be part of the, there's so many factors it could be, but this would be an easy study to do. Would it be this simple? Supplement them and then follow that cohort of kids over time and just see if everything else being equal, there's less autism diagnosis or less severity or anything in that group compared to the control group.
What's the result of excess vitamin D?
Well, you can get excess vitamin D. You can get a thing called hypervitaminosis D. Okay. But you've really got to take a crap load of vitamin D to get that.
Okay.
It can be hard to do it.
It's really difficult to do.
Oh, okay.
That's like crazy people taking bottles of vitamin D. And
like
stuff.
hundreds of thousands of them at a time.
Yeah, let me see.
Literally.
Oh, no.
Instead of...
Well, I take 5,000 IUs a day.
No, why do you take so much? Because that is more
coming from Michigan, we had a lack of sun.
Yep.
And so every time I got tested when we were here, if I had a blood panel run, it was always low. So that's just how much I've been taking. But I didn't know if I'm... But each time I go back, they're like, hey, your vitamin D is perfect. Okay. So I keep taking it.
Okay. You may be able to get it perfect with a lower dose.
Yeah.
Like, I usually recommend 400 to 1,000 here.
Yeah.
Because you are exposed to more sunlight here.
Yeah.
Let me see here. In the United States, overdose exposure to all formulations of vitamins was reported by 62,000 individuals, with nearly 80% of these exposures in children under the age of 6, leading to 53 major life-threatening outcomes and 3 deaths, 2 from vitamin D and E.
Whoa.
And vitamins A, D, E, and K, I always remembered ADAC in medical school. Those are the fat-soluble vitamins. They're the ones that can accumulate.
Okay.
Let me see here if it says what the dose of vitamin D. Let me see. Google. Hey, you got your computer, Dr. Scott?
Mm-hmm.
Google hypervitaminosis D and see how much really you have to take to get that. Let me see. I'm looking at medical news today. Right here is the first thing that came up. Rare but potentially serious condition occurs when you take too much vitamin D. Result of taking high-dose vitamin D supplement. So let me see. Yeah, the Mayo Clinic states recommend dietary allowance of vitamin D for most adults is 600 IU a day. Doctors may prescribe higher doses to treat medical conditions. And you're really at higher risk of hypervitaminosis D if you take the high-dose supplements and you've got kidney or liver disease or something which you don't have.
Yeah.
It can cause calcium levels in the blood to rise, causing loss of appetite, fatigue, weight loss, excessive thirst, excessive urination. That'll make you think you had diabetes. Constipation, irritability, nervousness, that kind of stuff. So,
Ooh, irritability.
yeah. Yeah.
We don't have that.
Wow.
Let's see here. Okay. Oh, well, here we go. The tolerable upper limit or the maximum daily intake of vitamin D that's unlikely to result in health risks has been set at, 4,000 IUs per day. Mm-hmm. Adverse effects have been seen in those taking less than 10,000 IUs a day over an extended period of time. So, it will not hurt you one bit to drop down to 1,000, and then the next time just check your blood level. And if it's normal, then you're fine.
Okay.
You may not need that excessive amount. Now, I'm not your physician, so, you might want to run it by them, but I think that'd be totally fair. I actually wasn't aware that anything above 4,000 was considered excessive. I have seen people on that 5,000.
Well, when we first moved here, that was prescribed.
Yes.
So, but it was like
you must have been really low.
Oh yeah, one day of sun for 31 days up there. No.
Yeah.
Good.
Yeah. Yeah.
Yeah.
Okay. I don't think I can handle that.
Yeah.
All righty. Well, you guys want to answer some questions?
Let's do it.
All right.
Number one thing. Don't take advice from some asshole on the radio.
All right. Very good. Thank you, Ronnie B. What a good feller.
You're so polite.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Well,
you've talked at length on many of your shows about Fordyce spots, Fournier's Gangrene. Maybe it's Fournier's Gangrene. I don't know. I'm not French. And the Valsalva maneuver.
Yep.
And other treatments and conditions named after people. But I'd like to know more about the people behind the names. Anyway, thank you for your time. And,
Yeah.
Au quoi tangenois.
Thank you, my friend. He was speaking Biavian.
Yeah, of course. I was going to say.
We'll need to press 1 for English.
So, Fournier gangrene, let's just talk about that for a minute because it's fun. It is also known as necrotizing fasciitis of the genitals. Do not Google image this if you have a weak stomach. So everyone in here, please go ahead and Google image this on your phones while I'm talking about it. Fournier gangrene. It's Fournier, Fournier gangrene. So in 1764, this guy named Barrian, who was a French physician, described an idiopathic, meaning we don't know, the doctor's an idiot and the patient's pathetic. That's what the medical humor there. Idiopathic, it just means we don't know where it's coming from. Rapidly progressive soft tissue necrotizing, meaning killing, dying, process that led to gangrene of the male genitalia.
So that's the only place that...
That's where Fournier gangrene is. Yes.
Oh, okay.
Just that location, yeah.
However, the disease was okay.
Pretty gross.
The disease was named after Jean-Alfred Fournier, a Parisian venerologist, meaning that his specialty was sexually transmitted diseases.
I love to masturbate.
Which is one way to not get an STD, by the way. On the basis of a transcript from an 1883 clinical lecture in which Fournier presented a case of perineal, that's taint, gangrene, and an otherwise healthy young man, adding this to a compiled series of 4 additional cases. He differentiated these cases from perineal gangrene associated with diabetes, alcoholism, or known trauma. So, anyway, the manuscript outlining Fournier's initial series of fulminant perineal gangrene provides fascinating insight into both the societal background and the practice of medicine at the time. In the anecdotes, Fournier described recognized causes of perineal gangrene, including placement of a mistress's ring around the phallus. So they were using cock rings back then. Ligation of the prepuce, used in an attempt to control eneuresis. The prepuce being the foreskin, or as an attempted birth control technique practiced by an adulterous man to avoid impregnating his married lover. So I guess what they were doing was they were ligating it, meaning that they would pull the foreskin up and then tie it off.
Yep.
Yeah. And so if
that's your own condom.
It was your own reservoir tip, right? So they would tie off the tip of their foreskin, and then they'd bang their mistress, and then pray that the that the tied up foreskin would hold in their delightful present.
The super glue or the duct tape held.
Yes, that's right. The delicious life-giving substance.
I'm sorry I looked that up.
Yeah, I'm okay. Well, who ever heard of that? Now that's a new one on me. And so then these guys would tie it up, and then what happens? You have intercourse, you fall asleep, right? Then you forget to untie this thing, and now it gangrenes off, and you got a hell of a lot of explaining.
It sloughs off.
Yeah, and you got some explaining to do to your spouse.
No,
sir.
Idea.
Oh, here's another one. Another person placed foreign bodies, such as beans, within the urethra, and then excessive intercourse in diabetic and alcoholic persons. He calls upon physicians to be steadfast in obtaining confession from patients of obscene practices. See, we used to use language in the medical, like when we're doing a history and physical, patient admits to marijuana use. Well, we've taken that out because admits to sounds like you're doing an interrogation, right?
Right.
It's not our job to interrogate people. We're supposed to be non-judgmental and just get the facts. But back then, he wanted a confession from patients of their obscene practices. So that was Fournier.
So a bean in it. Put a bean in it.
Yeah, I guess they were thinking if you put a bean in it, then when you bust a nut,
That was bust a bean.
you were busting a peanut, right?
That has to be some really good woman part.
Yeah.
To do all that.
Or you're just desperate not to get somebody pregnant and you don't have birth control, you know?
Oh.
So you're trying anything. So the Valsalva maneuver. The Valsalva maneuver is like when you are you make the maneuver like you're taking a giant dump, but you have your sphincter closed, so you're not actually going to force out fecal matter. That's the Valsalva maneuver, and we'll use this for lots of different things, including even stopping certain cardiac arrhythmias and stuff. But that was named after Antonio Maria Valsalva.
Cool.
He was an Italian anatomist born in Imola. His research focused on the anatomy of the ears, and he coined the eustachian tube, and he described the aortic sinuses of the Valsalva in his writings. Now, so the reason that the Valsalva maneuver is associated with him is because we use it to open up the eustachian tubes. So the eustachian tubes are the tubes that go from the middle ear into the back of the throat. So every air-filled cavity in the human body has an exit, at least one. The gut has an entrance and an exit, but the sinuses tend to have just exits. And the middle ear is also an air-filled cavity, and it has to have an exit to equalize pressure, right? So when you go up in an airplane, the pressure on the outside decreases. If your eustachian tubes are closed up, your ear drums will bow outward, because the pressure inside is greater than the pressure outside. So you yawn or chew gum or whatever, and then the eustachian tube will open up, and then it'll come down. When you're going down, the air pressure is increased compared to the pressure inside the middle ear, and so the eardrums will bow in, and that's when you do the Valsalva maneuver, where you hold your nose and put your nose forward in the position like you're smelling flowers, and then blow. Like that. Could you hear my ears pop? You couldn't? Okay, it's really loud in my ears. Sometimes I wonder if you can hear it on the outside, but
nope.
But anyway,
Something
and then
popped.
so you're forcing air up through the eustachian tubes into the inner ear to equalize the pressure, and it feels so good when you're coming down. And so yawning, going up, blowing, coming down, and teaching your kids how to do this. I taught my kids very early age how to do the Valsalva maneuver so that they didn't have horrible pain when you're descending in an airplane, because a lot of times if you've been in a plane and the plane is descending and all of a sudden the kids in the cabin start screaming, that's what's going on. And you can get a ruptured eardrum from that. It's called barotrauma when that happens. But anyway, that's Antonio Maria Valsalva. So these people, I am not a fan of eponyms like Peyronie disease. Some guy named Peyronie got to name a scar in his penis, but there's not a real good simple name for that. It's scar in the penis curved to the right or the left disease. So, there's not a great disease for that. Fournier's gangrene sounds cooler than necrotizing fasciitis of the male genitalia.
Yeah.
So that's why we use those, because it decreases the number of words you have to use, but then you got to learn what it is.
Yeah.
And then it becomes sort of code. And I'm saying Fournier's gangrene, and I can talk to another physician, but it's kind of a code that we're using, so I don't like that. But
Right.
Anyway.
The other thing, too, if you're explaining something, you're going to want to make sure you're using the right words.
That's right.
Yeah.
We had totally true. Go ahead.
Well, my friends, our best friend's a chiropractor. Lady comes in and says her husband has fellatio on his feet.
Well. So what was she trying to say?
Probably
I'm sorry, Dr.
fasciitis.
Plantar fasciitis.
Yeah.
Fellatio.
Yeah,
on his feet.
fellatio.
That's close.
That's a good one.
But
I've heard fireballs in my universe. That was fibroids in my uterus. That's a good one.
I hear rotary cup.
A rotary cup.
All the
cup?
time.
Oh, yeah.
Instead of rotator cuff.
And then there's the regional stuff. Like in North Carolina, they'll say they got the gouge instead of I have gout. They got the gouge.
Can you give me my gout pills?
And here we have a lot of wing bones and
wing bones of the
scapulas.
scapula would be the shoulder blade.
Yep.
And the other thing we have here that's weird are leaders.
You got leaders, yep. That leader right there in my neck.
Yeah, leaders are tendons.
Yep.
Oh.
And it comes from, my hypothesis is that it's leaders is what they're saying, and it's like the leader on a fishing line.
Yes,
because
exactly.
that's the tough part of the fishing line.
Yeah, the leader.
And they kind of look like leaders.
Yeah.
Tendons do. So anyway.
That's crazy.
Yep.
Yeah.
Right.
So please know what you're saying.
Yes. Well,
or have some hillbilly like
Or
Dr.
don't.
Steve.
Yeah.
We can translate.
And we also, in the medical profession, have got to stop saying, there's two words that we use totally differently than all of our patients do, and it causes confusion.
Okay.
And that's positive and negative.
Positive and negative,
Yep.
yeah.
So if you have a positive attitude, that's a good thing. If you have a positive balance in your checking account, also a good thing.
Sure.
If you have a positive biopsy, that's a bad thing.
Yes.
And so I had a friend of mine, his mom called him on the phone and said, "Oh, thank goodness, my influenza test was positive."
Oh.
They just
That's
told her,
not
"Yeah, your
good.
influenza is positive," and gave her a prescription. Didn't tell her anything. It just handed her a prescription. She figured she didn't have to fill it because she doesn't know what whatever the generic for Tamiflu is.
Yeah.
Why can't I remember that all of a sudden? Tamsulosin. It had that on it, so she doesn't know what that is, and she just went home and said threw the prescription in the trash. Well, my test was positive. Meaning,
it sounds good.
That's
but
good, right? So shitty communication on the part of medical providers is one of my pet peeves. So we should use normal and abnormal. Negative, same way. You can tell somebody, well, your test was negative, and they'll go, because negative is when is that ever good?
Right.
Negative attitude, negative balance.
Yeah.
So
Well.
So anyway, normal and abnormal, please, for the medical students, residents, and physicians that are listening to this.
Yeah.
And we use. I don't say metastasize. We'll say spread. Stuff like that. Trying to use more plain language.
Yeah.
All right. This is a good one. I think I've got one for Dr. I've got two for Dr. Scott. Let's do this, and then we'll get out of here for today.
It's a good thing you showed up, Dr. Scott.
Yeah. Good thing.
It is.
Hey, Dr. Steve. 3 months now, I've had tremendous mucus flow down the throat. Been living off of Mucinex. Probably taking at least quadruple the suggested dosage of Mucinex. I take allergy shots, allergy pills, a lot of other meds, but I have no way to stop this.
So what did he not mention that he said he's taking allergy shots and allergy pills, but there's a third thing that.
I know.
Yeah, go ahead.
Nasal spray.
Oh, okay.
Oh.
Yeah.
Well, yes. Okay, so there's a fourth thing.
Yes.
Reflux. He's not taking any. This could be reflux. So the question is, and I'll let you wax eloquent because I know you have a lot to say about mucus. The mucus can come from different places. It can come from above. The problem can be above, where you're just producing a lot of mucus in the nasopharynx and it's draining down the back of your throat. But it can be coming from problems below too, from the lungs or from the stomach. If you have reflux and you're laying down at night and you have this horrible acid crap running up into your oropharynx in the middle of the night, it's toxic, and it can cause inflammation of those tissues, and you'll produce more mucus that way as well. And not everybody that has that has symptoms with that. They don't have heartburn. So anyway, what were you going to say, Dr. Scott?
Well, I was going to just say that one thing he did not mention, though, is dietary. Possibly the
talk about that.
What we see a lot of times with people really excess
dairy.
Mucus is their dairy products. Certainly, if he's drinking a lot of milk products, that can cause a lot of the phlegm.
Give yourself a bill.
So I would definitely discuss that with him, and certainly then try to figure out if it's coming from the top. If it is a nasal spray to wash out that phlegm is going to be a great idea.
Or a Navage.
A Navage.
Go to drsteve.com, scroll down, find the Navage, the greatest invention. And look, You can do a neti pot. Neti pot's cool. You can do Dr. Scott's nasal rinse,
which is far superior to those two. But anyway.
I agree with that for a lot of things. Check it out at simplyherbals.net.
Cool,
but for just mass cleaning out of crap in your nasopharynx, you cannot beat that damn Navage because it's motorized. So it's like, I always akin it to the people doing Pilates instead of doing yoga. So the yoga, a yoga master comes to the United States and they do all these cool poses and down dog and up dog and greet the day and all this stuff. And then they go into a Pilates studio and they would be horrified to see these people trying to attain these same things using pulleys and shit.
Right.
Pulleys and ropes and stuff. Well, the Navage is kind of this, the Navage is to Pilates. The Navage is to the neti pot as Pilates is to yoga, in that it's motorized and it's all
on steroids.
Newfangled, but it is awesome. And there are positions I can't attain without using pulleys too. So
does it just shoot it up there?
Yeah. So what it is there's a reservoir in the top, and you put saline in it.
Sure.
And then there's a reservoir in the bottom where everything goes.
Okay.
And then you've got two little prongs, and you stick them both in your nose, and you're just sitting up straight.
Okay.
And you just put it in straight because the floor of the nose is parallel to the ground.
Yeah.
So you don't want your head up or down. So and then you turn this thing on, and if you push it in halfway, there's suction on one side.
Okay.
And then you get the suction going, and then you push it in the rest of the way. And once you've got that suction going, it's going to squirt water in the other side, which will make a transit through that nostril, and the suction will then pull it around the nasal septum and bring it back out the other one. It never goes down your throat. It's the coolest damn thing.
Because I do use a neti pot,
yeah.
And so it just gets so frustrating because you feel like you just can't get everything.
Yeah. That's what I like about this, because instead of just gravity, it's kind of like that ride at Disney, the Twilight Zone ride, Tower of Terror. Oh. It drops, but it doesn't just drop. It drops faster than the rate of gravity if it was just free fall.
Oh, wow.
Okay.
Shoot.
So, but it gives it a more intense drop, right? Yeah. So it actually pulls you down faster than 10 meters per second, which is what free fall is.
Sure.
Yeah. So it's the same thing. It's more, you get more force than you would with just a neti pot using gravity alone.
Okay.
So
I
love it. Go to drsteve.com, scroll down. They're under $100. That was the best 80-something bucks I ever spent.
Or you can go to Simply Herbals first and
try that
nasal spray first and see what works.
Or
seriously,
Dr. Scott's nasal spray has some peppermint oil in it, which has been demonstrated to be anti-inflammatory at the level of the gut. We don't have any data on the nasopharynx, but it does follow that it should work, and it certainly, from an anecdotal standpoint, is my favorite nasal spray of all time.
Yeah, but check his diet. That'd be my first thing. Yeah,
but do all that stuff, and if it is from above, just mass removing it so that your body doesn't have to try to get rid of it may help.
Right.
Mm-hmm.
All right.
Good luck.
All right. Let's do one more. Well, all right, you bastard.
So a milk allergy. That will cause excess mucus.
Absolutely.
Well, and it doesn't even have to be an allergy.
It's not even sensitivity. It's just milk is really.
Period.
It's plain milk is just so phlegmy. Anytime I have a child or a peds case that comes in with recurrent bronchitis or pneumonia, earaches, the first thing I do is take them off of all milk products, and typically it makes a huge difference.
Yeah, particularly in those older kids, we've got other stuff they can have.
Lots
you don't have to
beer,
drink milk.
vodka.
You don't have to drink the fluid from a cow's tit. I see these adults too, and they're just drinking gallons of milk. It's like, how much milk do you need?
No. Does that have issues for acne too? I had a girl that was asking about her acne.
Potentially,
he might say so. Well, I would say that the data doesn't support dietary things, but the traditional Chinese approach may be different. But
you got to figure if your body's trying to get rid of something that it doesn't like.
I was going to say maybe she's not getting phlegm, but maybe it's trying to come out the other way,
it's
like
toxic.
through her face.
It's toxic.
No, I don't think there's data to support that.
I agree there's no data, but I would at least try that first.
Yeah. Well, that's what I did tell her. I said, stop milk for a minute and see how it goes. And it cleared right up, but she couldn't give up milk.
Okay. Well, if it really did clear right up, that she's nuts if she went back to it. You can drink soy milk. There's almond milk. There's all kinds of stuff.
Yeah.
Now, if you make, let's just talk about acne for a second. If I had somebody with just zits everywhere and I performed a magical procedure that stopped any further zits from forming, and I'm talking about at the molecular level, at the pore level, it would take 6 weeks before they'd ever know I did anything. Because the zit that you have on your face today started 6 weeks ago. So if I make them all stop forming, it's going to be 6 weeks before you'll know.
Okay, gotcha.
So any intervention that you do, you got to do at least 12 weeks to say that it doesn't work. And that's what sucks about acne, because you try one thing, you got to go January, February, March. Okay, this sucks. Let's try the next thing. April, May, June. Now this sucks. And it can take years to find something that really works.
Kind of like being married.
Yeah, kind of.
That's birth control right there.
There you go.
Yeah, Dr.
That
Scott.
won't give you gangrene.
And I had, and lady diagnosis, too. We've all got our horror stories in that regard. Jenny's the only one that's got a decent marriage of the three of us. This is just your first, right?
Yeah. We've been together 25 years, married 23.
Well.
Hellfire.
Good for you.
Yeah. And I still like him. A lot.
He's a pretty good feller.
That's adorable.
Yeah.
Well, good for you.
Way to
go fuck yourself.
Way to fucking go.
Well, I don't have to.
Yeah. You're 100. She's
God damn
100. You're $150,000.
Damn, comedians always got a damn zinger. All right.
Thanks for rubbing it in.
All right. Here we go.
We out of here?
No.
Question for you. It might be a dumbass question, but what is heartburn? Both of my parents died from heart attacks. My little brother's had a heart attack. Older brother died from something other than a heart attack. So I'm the only one that's not had one so far. So every time I get a twinge in the chest, I get nervous about it. So got me to think of what is heartburn.
Yeah, heartburn's different than angina or angina. So you want to talk a little bit about heartburn, Dr. Scott? You have exactly 2 minutes and 42 seconds.
I was going to say, first thing, let's make sure his heart, with his history, is in pretty good shape.
Yep.
Number one. Yeah, but reflux typically is from stress. It's from foods, but it's where the acid bloops out of your stomach and up into your esophagus and causes some burning in your
inflammation.
In your throat.
It's usually a constant burning that will get better with, it's like an antacid or yellow mustard, as Dr. Scott has taught us over the years.
Yep.
And or
should respond pretty quickly to those two.
And if it does,
if it doesn't.
Now, angina or heart pain is different than heartburn. So that is typically a dull pressure in the chest, radiating to the left, may radiate to the left arm, associated with exercise. So you go upstairs and you have it. It can happen at rest, though, too. Usually there will be shortness of breath, maybe palpitations, skipped heartbeat, perhaps sweating, nausea, that kind of stuff. Very rarely do people present with all of those things, which makes it challenging. We can't just say, "Oh yeah, that's a heart attack." So if you think you're having a heart attack, you go to the emergency room. They do serial cardiac enzymes on you, and if they're going up, then you've got a problem. If they're not, then they're not. And a huge number of admissions to the hospital are for chest pain, rule out MI. Right. That's what it's called. And they come in, and you keep them for a day. If they're fine, great. If they're not, then they do further testing. So, all right, don't fuck around with that one. First time you have it, you should get checked. All right, well, thanks. Always go to Dr. Scott, Lady Diagnosis, Jenny McKinney. Anywhere you're appearing that we can plug?
July 5th, I'll be in Oak Ridge, Tennessee.
Okay, just in the
At the
town?
Grove? Yeah, I guess it's like 2 streets. I don't know. You should be able to hear me laughing over there.
Okay, and then you're doing, you applied for a comedy festival in...
Motor City Comedy Festival in Detroit, September 19th.
Okay, so we'll check that out as we know more. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 8 p.m. Eastern. Many thanks to our listeners. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.